You mentioned it's really important for the patient to have goals. Is it possible that in the initial sessions, that the patient isn't aware of those goals? Does that act as a relative contraindication, or is it still okay for the patient to engage in therapy where the goals are then formed through the relationship?
It is a bit of a relative contraindication. If I've done my 3 session assessment and I have no idea why I'm seeing the patient,
Mm,
I would say it's probably a bad idea to see the patient. And that's why I draw the distinction between Jungian analysis. Jungian analysis is about the idea that all of us, which is true, all of us are dragged along by unconscious forces, and we should understand ourselves and remove all of these unconscious factors. The problem I have with that is that it's open-ended, it's expensive for the patient, and it
mm,
also is it's also without a specific clinical focus. And it's a different kind of psychotherapy, and it's not the psychodynamic psychotherapy that is clinically focused. So you can have that approach, but it's a very different kind of psychotherapy. It's much more open-ended. It draws from different schools of thought, and it doesn't have clinical change as a primary focus. That is more about progressive revealing of the unconscious for its own sake. But if I'm seeing a patient, and the word patient I think is important because a patient implies a person who is suffering, and the role of a doctor is to alleviate that suffering. But before I can do that, I need to know what the problem is. If I'm
mhm,
seeing the person for 3 sessions and I have no idea what the problem is, and I can't even describe the problem, I'm probably going to waste a lot of the patient's time.
mm.
They would keep coming through, for my own self, my satisfaction as a doctor is knowing that I'm doing something that leads towards positive change for the patient, that leads to an improvement in their
Mhm.
socio-occupational functioning and reduces mental health comorbidity. So goals which are vague even after 3 sessions is a bit of a relative red flag for me.
Right. And when you say vague, what would they look like, and what would be a well circumscribed goal or goals?
So a good example that I would be saying would be is usually the reason for why the person is turning up for evaluation in the
Right.
first place. So there is an idea that psychodynamic psychotherapy is about the aha moment, the insight generation bit, where the person has their breakdown and says it's because mom never loved me, and then everything is sort of amazing and brilliant. And that happens, just not really as often as people think. Sometimes it's about having someone to talk to about their difficulties and to make sense of it. Another part is that the person is struggling to understand themselves, and that's a really good goal, because when a person says, I want to understand myself," they know there is something about themselves that they don't like, that they can't figure out. That's usually the unconscious. That's a really good sign that there is an unconscious part of their being dragging them through things. But the last and the most frequent way that patients present is to resolve a particular symptom, which is usually depression.
Mm,
And we have patients who have failed multiple antidepressants, but often will present with this unusual factor that they don't have a lot of melancholic features. Their affect can be surprisingly reactive. Sleep doesn't seem to be too much of an issue, but something is deeply wrong from a subjective depressive symptomatology, and with a time course that isn't adolescent oriented, but is potentially more trauma or specific psychosocial stressor oriented, but also the person has limited insight into. That's a bit of a hint that there is a unconscious process leading towards that. And that allows me to create a presumptive formulation, but with a lot of gaps, which is normal. It's
mhm.
perfectly fine to have a formulation where you don't understand what's going on. And I'd be very worried if after 3 sessions I understood everything about a patient. But in that formulation, it's about I have that specific symptom, and I think that it's something related to a particular issue. I'll give you an example. A case that there was a patient who there's a patient who I saw once, an elderly gentleman who had approximately a 10-year history of depression, failed multiple antidepressants, SSRIs, SNRIs, was being worked up for possible ECT, but in this sort of way, a very hardly, not too many melancholic features, and a time course of depressive deterioration that was associated with estrangement from his son. So he had a history of he over the course of the therapy, he talked about the issue that he was the son from a farming family. He had his parents go through difficult times, and felt an obligation to be able to work up towards his family sacrifices. And then his son was unable to continue with his professional career following a serious accident. Now, the son survived, but was left with
Mm.
a lasting physical disability that meant that he was unable to continue with his professional career. This led to a number of nasty arguments and eventually estrangement 10 years ago.
Mm.
And in the process of the therapy, we were able to discuss that, and I could obviously make a formulation about that. I saw him for 4 sessions, and on the fifth session, and he hadn't spoken to his son for about 10 years. On the fifth session, he didn't turn up, and I gave him a call to see what was going on. And he said, "Oh, look, Dr. Neil, you're a really nice guy and everything else, but nothing's going to really change in my life.
Mm.
We turn up, we're talking about the same things over and over, and I just know that nothing that you seem really nice at trying to help me, but this isn't going to really work. Anyway, I'm out in the city with my son right now, so I'm a bit busy. So I'm really sorry, but
Mm.
thanks for trying anyway." And I was
Yeah.
like, "Just come back, do the damn outcome measures." But yeah, and see, he had no idea that he got
Yeah.
better. He actually
Yeah.
never followed up with community mental health again. He didn't complain of any depressive symptoms whatsoever, and he had no idea about what it was. But what happened is that through the process of psychotherapy, he was able to make the connections himself and on an unconscious level, undo a 10-year cycle of deterioration. And
Mm.
that's what I mean in terms of so the satisfaction I got from that was knowing that a significant change had happened in a person's life that no
Mm.
SSRI was able to touch.